Welcome back. Back in June, we had our resident pediatrician, Dr. Elizabeth Meade, on the show to explain to us what happens to kids separated from their parents. This was a big concern during President Trump's zero-tolerance policy at the border, where children were being held without their parents. So listen to what Dr. Meade had to say back in June about that separation of kids from their parents when it comes to their mental health and well-being.
It's systematic child abuse. There's no question. The solution being reunification of the families that are separated and immediate cessation of the practice of separating them.
Okay, so Dr. Meade is back with us this morning as we are learning more about those children who have been reunited with their parents. So those were really tough words in that interview back in June, and it was a breathtaking interview in the fact that it was scary to think about. So talking about your words back then, and now that we're hearing about these kids being reunited, what is your take on this situation now?
You know, I think we're seeing a lot of the things we were worried about, which is even when kids are now being reunited with their parents, they're very different. They're having a lot of behavioral and mental health challenges. And I think that people who expected this to be a seamless reunification process are really finding out that it's not that at all.
All right, so and that's actually what I wanted to ask you about, because you're mentioning that experts are already noticing these differences in kids. The New York Times had a really impactful article this week. Here it is. I also posted it on my Facebook page, so you can find it there. Experts documenting these kids, how they are now. A lot of their parents are saying that they are different after reunification. They're describing kids that don't want to speak, kids who are dealing with sort of PTSD-like symptoms, mental health issues, anxiety. Dr. Meade, talk about these impacts. Are we talking about long-term issues here?
We absolutely expect to see long-term issues. So I think there's the acute issues, which our kids can be really scared, they can regress. So we see a lot of kids who go back sort of in their developmental progression. So in the article, there was a young 5 or 6-year-old child who was wanting to breastfeed again. And so we see a lot of kids that regress into those infant or childlike behaviors. But in the long term, we expect that these kids may grow up to have significant mental health issues or even physical health problems. We know that children who have toxic stress have a much higher likelihood of things like heart disease, chronic lung disease, and all sorts of physical problems as well.
And the reason we're talking about this, I mean, politics aside, this has been well documented, what happens to kids when it comes to that type of separation.
Absolutely.
So this has been scientifically proven in a way.
That's very true. And I think with these kids in particular, this is really a second or a third trauma for most of them because they've probably experienced violence in their home country. That's why they're fleeing in the first place. Then they have this traumatic journey, and then that final separation from parents can really be sort of a third impact on their mental health.
So my one hope of this article was that one of the doctors in the article stated that kids are resilient. So intervention, it can benefit them. But what kind of intervention are we talking about here? What's that going to take?
Well, absolutely any child who's been through this separation process needs counseling, and really the whole family needs counseling, so the parents and all of the children. And we need to make sure that they have access to pediatricians and good health care as well to really track these changes and to give them the interventions along the way that may help them develop that resilient response and go on to lead healthier lives.
Yeah, so we were even talking during the break a little bit. I mean, I know we can talk about the impacts now, but when we look at a kid and a kid's future, I mean, we're thinking about all types of things, you know, success in school, graduation rates, job rates, success, you know, socializing with people in society, holding down jobs.
That's right.
What are some of the possible real long-term effects if there is no intervention?
Well, mental health, I mean, we see this in patients all the time, that mental health really can impact many things across the spectrum. So certainly ability to have functional relationships as an adult with other people, domestic violence rates, crime rates, rates of going to jail, all of these things that we might not necessarily think about, school completion. And that really can affect the trajectory of someone's life and put them in a really different spot than they would have been if they had had the support services that they needed.
All right, so is there anything that maybe local parents watching can learn from these types of situations, or what we need to think about in the future moving ahead here? Well,
I think one thing parents can do is just to talk with their kids about what's going on and see what their children are feeling, because one of the secondary impacts we also see is that even kids who are U.S.-born citizens are feeling scared that they may be separated from their parents because they're hearing all this talk about it. So I think having family conversations, contributing to funds that help these kids and help these families with resources and with reunification and legal aid is really useful, and I think as a country we need to step in and do something.
Dr. Meade, thank you so much for being here and following up with us on that. I really appreciate that.